Hello, good morning and good evening to everybody in India, and welcome to our Pravachan Malike talk number 17. The talk is on islands and vision, what we can do to preserve and sustain. And we're so happy to invite the keynote talk by Professor Krishna Sharma today. And we'll start with the Veda Kusumanjali, and we'll have Sangeetanjali recordings by Srimati Suman Nagendra. And then my father, Dr. Prabhakar, will introduce the speaker, and we'll have concluding remarks by Dr. Gopi Chand and Dr. Viharati Bandaru. And then I'll be giving the last vote of thanks. So with that, I welcome you all, and I request the Veda Kusumanjali. Vasan sir, please.
Om Shri Gurubhyo Namaha Harihi Om. Om Bhadram Karne Vishnuyama Devaha Bhadram Pashye Makshabir Yajatraha Sthirairangai Stuštva Gumsastanobihi Vashema Devahitan Yadayuhu Swastina Indro Vruddhashavaha Swastina Pusha Vishwavedaha स्वस्ति नस्तार्क्ष्यो अरिष्टनेमिः स्वस्ति नो बृहस्पतिर्दधातु ॐ शान्ति शान्ति शान्तिः ॐ अग्नेनयः सुपथाराये अस्मान् विश्वानि देवा वयुनानि विद्वान् युयोध्यस्मा जुहुराणमेनो भूयिष्ठां ते नमभुक्तिं विधेम Om Shanti 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 Om Brahman Brahmano Brahmavarchasi Jayatam Arashtre Rajanyah Shura Ishavyo Ativyadhi Maharatho Jayatam Dogdri Dhenuhu Vodha Nadvan Ashu Saptihi Purandhir Yoshah जिष्णुरतेष्ठाः सवेयो युवा अस्य यजमानस्य वीरो जायताम् योगक्षेमो नः कल्पेताम् ॐ ॐ आप्यायन्तु ममाङ्गानि वाक्प्राणश्चक्षुः श्रोत्रमतो बलमिन्द्रियाणि च सर्वाणि सर्वं ब्रह्मोपनिषदं माहं ब्रह्म निराकुर्याम् मामा ब्रह्म निराकरोतु अनिराकरणमस्तु निराकरणं मे अस्तु तदात्मनि निरतेय उपनिषत्सु धर्माः ते मयि सन्तु ॐ शान्ति शान्ति शान्तिः ॐ एष मे देवा सविता चच्छन्दाय समानं न प्रविनाति धाम दिवो रुक्मावुरुचक्षा उदेति दूरे अर्थस्तरणे भ्राजमानः नूनं जना सूर्येण प्रसूता अयन्नर्तानि कृणवन्नवांसि यत्र चक्षुरमृता गातुमस्मै शेनो न दीयन्मन्वेति पातः उदुत्य दर्शतं वपुर्दिव येति व्रतिः परे यदि माशुर्वहति देव एतशो विश्वस्मै चक्षसे अरम् शीष्णो जगत सस्तु शष्पतिं समया विश्वमारजः सप्तस्वसारा सुविताय सूर्यं वहन्ति हरितो रथे तच्चक्षुर्देवहितं शुक्रमुच्चरत् पश्येम शरदशतं जीवेम शरदशतं वन्महाङ्गसि सूर्य बलादित्यमहाङ्गसि महस्ते सतो महिमा मनसत्तेद्धा देवमहाङ्गसि भट्सूर्यशवसा महाङ्गसि सत्रादेव महाङ्गसि मन्ना देवानाम सूर्य पुरोहितो विभोजोति प्रदाभ्यम् नमो मित्रस्य वरुणस्य चक्षसे महो देवाय तद्युतं सपर्यता दोरे दृशे देवजाताय केतवे दिवस्पुत्राय सूर्याय संसदा ॐ शान्ति शान्ति शान्तिः हरिः ॐ तत्सत् सर्वं श्रीकृष्णार्पणमस्तु ॐ तत्सत्.
Thank you, Vasan sir, very much. So now I'll play the Sangeetanjali by Srimati Suman Nagendra.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ಶ್ರೀ ವೆಂಕಟ ವಿಠಲದಾಸರ ರಚನೆ ಗಣಪತಿಯನ್ನ ಪಾಲಿಸ ಮಾಡ್ತಾ ಇದ್ದೀನಿ. ಗಣಪತಿಯನ್ನ ಪಾಲಿಸೋ ಗಂಭೀರ, ಗಣಪತಿಯನ್ನ ಪಾಲಿಸೋ ಗಣಪತಿಯನ್ನ ಪಾಲಿಸೋ ಗಂಭೀರ, ಗಣಪತಿಯನ್ನ ಪಾಲಿಸೋ ಪಾರ್ವತಿ ನಂದನ ಸುಂದರ ವದನ, ಪಾರ್ವತಿ ನಂದನ ಸುಂದರ ವದನ, ಶರ್ವಾದಿ ಸುರವಂದ್ಯ ಶಿರಬಾಗುವೆನು, ಶರ್ವಾದಿ ಸುರವಂದ್ಯ ಶಿರಬಾಗುವೆನು, ಗಣಪತಿಯನ್ನ ಪಾಲಿಸೋ ಗಂಭೀರ, ಗಣಪತಿಯನ್ನ ಪಾಲಿಸೋ ಆದಿಪೂಜಿತ ನೀನು ಮೋದವ ಕುತರಿಗಿತ್ತು, ಮಾಧವನಲಿ ಮನ ಸದಾ ನಿಲ್ಲಿಸು ನೀ, ಆದಿಪೂಜಿತ ನೀನು ಮೋದವ ಕುತರಿಗಿತ್ತು, ಮಾಧವನಲಿ ಮನ ಸದಾ ನಿಲ್ಲಿಸು ನೀ, ಗಣಪತಿಯನ್ನ ಪಾಲಿಸೋ ಗಂಭೀರ, ಗಣಪತಿಯನ್ನ ಪಾಲಿಸೋ ಪಂಕಜನಯನ ಶ್ರೀ ವೆಂಕಟ ವಿಠಲನ ಕಿಂಕರ ನೆನಿಸೆನ್ನ ಶಂಕರ ತನಯನೇ, ಪಂಕಜನಯನ ಶ್ರೀ ವೆಂಕಟ ವಿಠಲನ ಕಿಂಕರ ನೆನಿಸೆನ್ನ ಶಂಕರ ತನಯನೇ, ಗಣಪತಿಯನ್ನ ಪಾಲಿಸೋ ಗಂಭೀರ, ಗಣಪತಿಯನ್ನ ಪಾಲಿಸೋ ವಾದಿರಾಜರ ಕೃತಿ ಕಂಡೆ ಕಂಡೆನು. ಕಂಡೆ ಕಂಡೆನು ಕೃಷ್ಣ ನಿನ್ನಯ ದಿವ್ಯ ಮಂಗಳ ವಿಗ್ರಹ, ಕಂಡು ಬದುಕಿದೆ ಇಂದು ನಾನು, ಕಂಡು ಬದುಕಿದೆ ಇಂದು ನಾನು, ಕರುಣಿಸೋ ಎನ್ನೊಡೆಯನೇ, ಕಂಡು ಬದುಕಿದೆ ಇಂದು ನಾನು, ಕರುಣಿಸೋ ಎನ್ನೊಡೆಯನೇ, ಕಂಡೆ ಕಂಡೆನೋ ಕೃಷ್ಣ ನಿನ್ನಯ ದಿವ್ಯ ಮಂಗಳ ವಿಗ್ರಹ, ಪುಟ್ಟದಟ್ಟಿಯು ಪಿಡಿದ ವಂಕಿಯು ತೊಟ್ಟ ಕೌಸ್ತುಭ ಭೂಷಣ, ಪುಟ್ಟದಟ್ಟಿಯು ಪಿಡಿದ ವಂಕಿಯು ತೊಟ್ಟ ಕೌಸ್ತುಭ ಭೂಷಣ, ಮೆಟ್ಟಿದಾನವರತ್ನಧಾವಿಗೆ, ಮೆಟ್ಟಿದಾನವರತ್ನಧಾವಿಗೆ ಇಟ್ಟ ಕಸ್ತೂರಿ ತಿಲಕವ ಮೆಟ್ಟಿದಾನವರತ್ನಧಾವಿಗೆ ಇಟ್ಟ ಕಸ್ತೂರಿ ತಿಲಕವ ಕಂಡೆ ಕಂಡೆನೋ ಕೃಷ್ಣ ನಿನ್ನ ದಿವ್ಯ ಮಂಗಳ ವಿಗ್ರಹ ಮಂದಹಾಸವುದಂತ ಪಂಕ್ತಿಯು ಉಂದದ ಕಡೆಗಣ್ಣ ನೋಟವು ಮಂದಹಾಸವು ದಂತ ಪಂಕ್ತಿಯು ಉಂದದ ಕಡೆಗಣ್ಣ ನೋಟವು ಅಂದವಾದ ಕುರುಳುಗೂದಲು ಅಂದವಾದ ಕುರುಳುಗೂದಲು ಮುತ್ತು ಸುರಿವೋ ಮುಖವನ ಅಂದವಾದ ಕುರುಳುಗೂದಲು ಮುತ್ತು ಸುರಿವೋ ಮುಖವನ ಕಂಡೆ ಕಂಡೆನೋ ಕೃಷ್ಣ ನಿನ್ನಯ ದಿವ್ಯ ಮಂಗಳ ವಿಗ್ರಹ ಸುರರು ಪುಷ್ಪದ ವೃಷ್ಟಿಗರೆಯಲು ಅಸುರರೆಲ್ಲರೂ ಓಡಲು ಸುರರು ಪುಷ್ಪದ ವೃಷ್ಟಿಗರೆಯಲು ಅಸುರರೆಲ್ಲರೂ ಓಡಲು ಕ್ರೂರ ಕಾಳಿಯ ಫಣಗಳಲ್ಲಿ ಕ್ರೂರ ಕಾಳಿಯ ಫಣಗಳಲ್ಲಿ ಧೀರ ಕುಣಿದಾಡಿದ ಕ್ರೂರ ಕಾಳಿಯ ಫಣಗಳಲ್ಲಿ ಧೀರ ಕುಣಿದಾಡಿದ ಕಂಡೆ ಕಂಡೆನೋ ಕೃಷ್ಣ ನಿನ್ನ ದೇವ್.
Okay, Nana, can you please introduce the speaker? That's a very nice song, appropriate for the topic of the day. So thank you for Suman Nagendra. Yeah, Nana.
So we welcome Dr. Krishna Sharma, and so he has been associated with the eye research, eye technology. And long back when I met him somewhere in Surrey, I asked him, sir, what are you doing? He did not speak much, probably was busy at that time. Said, we're all working on the protein for the retina and so on. But I didn't, afterwards I heard his lecture in the university on cataract and all that. I was just simply super. So memory was simply lying green in me. I've been requesting Dr. Krishna to give us also about eye, because sarvendriyanam nayanam pradhanam, sarvasya gatrasya sirah pradhanam, sarvendriyanam nayanam pradhanam is being. That is, for all the parts of our body, the head is important, siraha, and among all others, the eye is important. So the eye, netra, is neither. And there are hundreds of meanings and interpretations and all wisdom statements on eye. But the eye is the light. That is the light that is available in our body. And the light outside available is Surya Bhagavan. Therefore, Vasan has appropriately recited some mantras related to Surya Bhagavan, who is supposed to be the son of the Jau, Divas Putraha. And he is that Devahitam Chakshuhu. He is the eye, divine eye, who is doing a lot of good for all people in the world. And he is like that. We have a lot of description about the Surya Bhagavan, who is the repository and who is the promoter and whose grace is very important. Therefore, Ravi, Surya is important. Now, again, we have today we have also the Ganam or the Sangeeta Anjali, Ganapati. And Ganapati is also the very important deity for our eyes, because every day we say Agajanana Padmarkam Gajanana Maharnisham Anekadam Tam Bhaktanam Ekadantam Upasmahe. There Agaja Anana Padma Arkam. So Ganapati is taken to be the Surya Bhagavan for the Padma Mukha of Ganapati. That means the Ganapati is the lotus, Mukha is lotus, And lotus becomes completely electrified and happy the moment it looks at the Surya. Therefore, so he is the Surya and Amavaru is the Padmar. So like that, we have a number of metaphorical expressions speaking about the importance of that. But today, therefore, I requested him, sir, you just talk about it. Then immediately he came back. I'm very thankful to him. Talk about the islands, vision, and preserve and sustaining and all that. So these are all very important things because without I, nothing is there. I is the Gnana, I is the leader, I is everything. So we are today having the fortune of knowing some ideas of eye and eye research and eye preservation and also cautions that we should protect our eye from the great professor who is the director of ophthalmology department in a big university, And before that, I should also thank Dr. Anjanaya Prasad, who introduced him to me when we happened to be there. And anyway, all of us have now met to know about the netra, about the chakshu. And see through, there are two kinds of chakshus. One is charma chakshu and gnana chakshu. Charma chakshu is the physical eye, which all people look at it. And gnana chakshu is the retina and all the equipment inside which God has provided. And there is a lot of research and I don't know much about it, but I now want to know more about it, or let us all know more from Dr. Krishna Sharma. And he is basically from India, Bengaluru and all that, Kundapur and all that area. Therefore, incidentally, even Suman also picked up Kannada songs that he will be able to appreciate. So one is the prayer to Ganapati, and another is prayer to Krishna, who is the Kanna. So he's called Kannan also. That Kannan is Krishna, and his avatar is Pampurna avatar. So with these few words, not speaking much about this Kannu, and I give to Dr. Krishna Sharma, who is also Krishna. And so Sharma is giving us comfort and happiness and cure. Sham is the happiness, comfort and health. So we are just requesting to talk to him. Now, Dr. Krishna Sharma. Welcome, sir.
Thank you. Thank you for inviting me to share my thoughts about some of my work and also overall eye health and diseases. That's what I'm going to talk next maybe 30, 40 minutes or so. And I also would like to thank Prasad for taking care of these technical issues and making this to happen. And I can share my screen, right, Prasad?
Yeah, you should be able to share, yes.
Yes, we see the screen.
Eye is the most important organ in our body because it is required to appreciate our surrounding. For example, if you want to see the nice flowers or a nice portrait, a painting of, for example, the Picasso painting or the painting of Ravi Verma, if you want to appreciate it, you have to have a good eyesight. Otherwise, we will not be able to appreciate our own surrounding. We cannot see our own family members and how they grow, every year, or if they are kids, how they change. We cannot appreciate those things without a good eyesight. So again, in Hinduism, there's a great emphasis given to the visual interaction between the deity and worshippers. As we all know, we want to see God well decorated with the flowers and ornaments. Then we really say, okay, Kannu Tumba Devarannu Nodide. That means, we really have that connection between the God and the worshippers. That happens only when we can really see the God. We all pray God. That's very important in Hinduism. So other thing is, Vishnu is a preserver and protector of the universe. So different name of the Vishnu is also associated with the part of the human body. For example, the right eye, we refer to as Aniruddha. That's one of the Vishnu's name. So left eye is Purushottam. That's another name of the Vishnu. So as Professor Prabhakar said, Surya is again associated with the eye. So eye is also associated with the cosmic element Tej, or Tejas. That's why there is a very strong recognition of the importance or the necessity of having a good vision in our life. Having said that, so if you read newspaper or talk to other people, you will always know there's a lot of people have vision problem. Because at this time, the total world population just crossed 8 billion. Nearly 2.2 billion people around the world have vision impairment. That means, 1 in 4 have some type of vision problem. Out of this 2.2 billion, nearly 1 billion have impairment that's not taken care of. This is due to refractive error, cataract, glaucoma, corneal opacities, diabetic retinopathy, trachoma, that's a bacterial infection to the eye, and presbyopia, that means, uncorrected eye. We cannot really focus well. So all these issues cause problem that limit us from appreciating our surrounding. For that purpose, furthermore, we also need this good eyesight, because just by providing a glasses to a person who cannot see well, his or her productivity goes up by 22%. If a person in the family has a cataract, if you just remove that person's cataract and give a pair of glasses, the family income can go up to 80%. That's an estimate. So other sad part is, women are 12% more likely to have vision loss than men, because women access the healthcare less compared to men. And most of the eye problem comes to people above age 50. That also, among refugees or internally displaced people because of the conflict, or the migrant workers, there is increased incidence of vision loss. So eye health is also critical to reduce the traffic accidents. If a person if individuals have cataract, that can increase the vehicle accident by 2.5-fold. So that means, every aspect of our life depends upon a good eyesight. So vision impairment global affects about over $400 billion in economical activity. So right now, it's estimated that about 15 billion is required to take care of refractive error or the cataract immediately. So by 2050, nearly 4.8 billion people will have some sort of visual impairment. That means that the problem is huge. It's not going to go away, because as we get older, the vision problems generally increase. It can be presbyopia or macular degeneration or glaucoma or other host of other eye-related issues. And people with diabetes, they may develop diabetic retinopathy, which can severely debilitate a person's vision. So the thing is, almost everyone needs to go to an eye doctor during his or her lifetime. That's important too. So having said that, let's look at what is now, how it is. We can all see only from the outside, transparent cornea. Transparent cornea. Whereas, just behind the cornea is the lens. I don't know how to use the cursor. The transparent lens. And from the lens, behind the lens is a vitreous, it's a jelly-like substance. And the extreme back of the eye is the retina that collects the signals and sends to the brain through the optic nerve. So what you can see is, eye as such is a very complex organ. So there can be problem anywhere along the way that can interfere with the vision. For example, if there is an issue with the cornea in front of the eye, that can impede or prevent the light falling on the lens and the retina. If there is a problem in the lens, because of the clouding or cataract formation, it cannot allow the light to pass through it, so that, as a result, light will not fall on the retina. So no signal will be generated. Or if there is a problem with the retina, that's again a major issue. You will not have vision. Then comes the optic nerve and the brain for processing of input. So overall, you can appreciate how many places things can go wrong. It's amazing, human body is an amazing creature, or creation of a God, one can say, which can recover from so many insults or so many damages. So again, if you look into our Ayurveda system, the vision has been well recognized in a parallel way to modern medicine. In the modern phase, we say that light energy or the photon, that's the one generates the signal, starts signaling. Then it is converted into electrical signal and then goes to the brain where its image is processed. Whereas in Ayurveda phase, what you call is the tejas. That's the light. So that's again processed through Ranjita, Rasadhatu, and then Sushma, Saraka, Guna. And finally, the Jnanam is realized. So there is a parallel, but only the disadvantage in Ayurveda, I would say, is they don't have, Ayurvedic doctors, they don't have the sophisticated diagnostic tools what we have in the modern medicine. We can look into the back of the eye or look into the retina. The Ayurvedic system, there is nothing available. All by symptomatic treatment, they do it. So again, even in Ayurvedic medical system, they do talk about the visual processing, or how the light energy is converted into electrical energy within the eye. They refer the retinol, that's a small molecule that gets activated, as a Ranjika Pitta, and then it interacts with the rhodopsin. That's in Ayurveda called Ranjika Rasadhatu. So then this interaction finally leads to the production of electrical potential, or in Ayurvedic they call it Diksha, Sushma, Laghu, and Ushna Guna. All those things happen. So that's how one can see or visualize things. So I'm not going to go to the details of all this mechanistic activation or biological phase of the vision. That itself will require several hours of discussion because so many biomolecules are involved in the process. So next, I will go by section-wise in the sense. So initially, I talked about the cornea of the very front of the eye. So if you expand or if you take a closer look at the cross-section of the front of the eye, the cornea, it has 5 layers. So what you see here is the epithelium, endothelium, and in between there is a stroma of collagen. So though it is very transparent, it has 5 layers. Anything can go wrong with this because it's constantly exposed to the outside atmosphere. So if there is a problem with the epithelium, which is always covered with the tear film, so that is very important. When there is a decrease in the tear film formation, one gets a dry eye, some kind of irritation, dry eye. When people get older, it is quite common to have dry eye. So you have to have some soothing eye drops at that point. And some people may have some other underlying issues that leads to dry eye symptoms. In those situations, one has to see an ophthalmologist to get some medication. There are few medications available right now and some in the pipeline. So if there is a problem with the cornea, then cornea can turn whitish color or opaque. Sometimes the people need a replacement of cornea because cornea can get diseased at that point. That has to be replaced with a donor cornea. This is where the eye donation comes into picture. Whenever we hear about the donation of eye, what it means is the donor's cornea from the eye is cut and taken out and put in a recipient's eye. That's what it is. So when we talk about the eye donation, though one might assume that the whole eye is transferred, it's not. So only the anterior portion, the cornea portion is transferred to a recipient. That's basically. Now the things are so advanced that they can even transplant one layer of the cornea to the recipient. Basically, one. That's very important. In the United States, there's about 40 to 45,000 cornea transplants occur every year. They do cornea transplant in India, but not to the same level as US. US has surplus donors. Some of the corneas are exported to other countries as a donation. So cornea from a donor, it can be preserved up to 2 weeks. So there is enough time to transport the cornea to another country and put it on a recipient side. A tiny country, for example, Sri Lanka, the people are very conscious about eye donation. That is considered a supreme sacrifice in Sri Lanka. They donate about 2,000 to 3,000 cornea to other countries. Very amazing. So that's inherent to that people's determination or their religious belief. So then whenever there is some irregularity on the cornea, that is called, leads to astigmatism. So 1 in 3 Americans have it. So it's not an uncommon issue. So if there is a astigmatism, one can have the blurry vision or a poor eyesight at night. Those can be easily prevented or taken care of or treated with eyeglasses or contact lenses. So it's not a huge problem. But one has to go to the ophthalmologist and get the necessary treatment. So say if this figure shows how blurry it would be if one has astigmatism. So that can be corrected. So therefore, I think it's important that we all take care of our eye health, starting with the cornea. Some of the diet components that will be really helpful for the good health of the cornea is, green vegetables for us, or like broccoli or spinach, or nuts, walnuts, or carrot. Carrot has got carotenoids, so flavonoids. Those are good for the cornea. Also, you can have sweet potato. That's also good. Yeah, those who take non-veg, there are other sources as well. So next, I will spend a few minutes talking about the lens. That's the part of the eye that I have worked for last 30 plus years. So the lens is situated between the retina and the cornea. It's kind of, gatekeeper for the light to the retina. So lens is a very unique system. It doesn't have a blood vessel. It has a very unique specialized cells. We call them as fiber cells. And that's all made of protein. That's all. So if it looks like a cross section of an onion, if you concentric layers, that's because of the cells. They don't have blood supply, as I said earlier. So the proteins that are made in this lens, they are made when you are born. So individuals with 60 years of age will have 60-year-old protein, or 80-year will have 80-year-old protein. It's amazing. Once the protein is made, it stays around such a long time. But the problem is, because the protein stays there such a long time, whatever insults occur over the lifetime, they tend to accumulate. This leads to the changes and clouding of the lens. I will tell a few more points about the clouding of the lens in a couple of minutes. See, as you can see, the lens is a very, very, very unique tissue. So it has, so again, with respect to vision, we say, okay, now either person has a nearsightedness or farsightedness, or myopia, or myopia is nearsightedness. So what you can see is, if a nearsightedness is on the things very close to us, we can see very well. Where with the farsightedness, the things that closer are not very clear to us, whereas things that are far away are much more clear. That is because the following. See, when nearsightedness or the myopia, the lens focuses the light not right on the retina, right in front of the retina. Because of this, light is not correctly falling on the retina for further processing, visual activation. In hyperopia or the farsightedness, the light falls much behind the retina. In the sense, it's not falling on the focal point, or the so-called the macula and fovea region. So see, about 40% of the Americans have this myopia or the nearsightedness, whereas the farsightedness is less common. It's only 5 to 10%. So, but both have the refractive error. This can be treated by compensating with the help of an eyeglass. If you go to a optometrist or a ophthalmologist, they will test you and give appropriate eyeglasses. That's important. See, both this nearsightedness and farsightedness have some common issues. If one has this, as this Venn diagram shows, it can lead to having some eye strain, headache, squinting, can affect other kinds of vision, or it can be easily treated with the corrective lenses. That's important. So one should go to a doctor and get the necessary prescription, get eyeglasses. The most common issue with the lens is the cataract formation. Almost, there are a lot of people with age 60 or 70 above will have this cataract, and which can be easily removed by the ophthalmologist. So in this slide, I'm showing 4 pictures. One is the normal eye. You can really appreciate the lens is clear. The cataract, you can see a slight opacity is one of that. Whereas in the other 2 lenses, one has a really dense cataract, we call it as white thing. So it's another one, there's some clearance is there in the center, but there is some opacity all around as well. So this, what happens, proteins are generally transparent, but when they clump together, they start scattering light. That's why you see this white color or opacity. If you take out those lenses and put it in a glass dish, you will see it like this. So these 2 lenses are cataract lenses taken out from patients at the time of surgery. You can see them, they are not clear. Only in the one lens you can see at the edges somewhat clear, whereas the other you can see a lot of whites material there. So that's all scattering light, so it doesn't allow the light to pass through. So if a person has cataract, this is how the person will see. So on the left side, it's a normal vision that's whereas on the right side, you see the age or cataract vision. This is a picture of the Jesse Hall from a cataract eye. Whereas on the left, normal vision, you can see a very clear dome of the Jesse Hall, the University of Missouri Administrative Building. And below are the 2 lenses taken out from human eye. On the left, you can see the 2 lines, fairly well seen. That means the lens is transparent. Whereas on the right, slight, orange, yellowish lens, you can't see the line behind. This is what happens when an individual has an advanced cataract. You cannot see, light cannot pass through, and you cannot see what a good image is not created. In US, it's about 3 million cataract surgeries or operations are carried out every year. It costs about $8.8 billion. It's an estimate. This is one of the major line item in Medicare expense in the United States. So what are the risk factors for the cataract then? As I said earlier, aging is one of the major risk factors for development of cataract because the accumulation of insults on lens proteins. Next comes the diabetes. It's also a major risk factor because what happens is in the diabetes, in the whole body, there is effect. So also the lens. The diabetes means a person has more sugar in the blood. The sugar can react with the proteins. Then it changes the protein property. That leads to clumping of lens proteins. That leads to cataract formation. Then the UV rays And smoking. Smoking also very bad. It is another risk factor for so many other health problems. Same thing with the lens. It can increase the risk of cataract. UV rays. UV rays are bad for proteins because proteins have certain components called amino acids, which are sensitive to UV light. So when the UV light falls on this lens, it can modify the protein. That's why it's always advisable not to, protect your eyes from UV rays. So one way of doing it is using eyeglasses or the so-called cooling glasses, which will cut off the UV rays above 400 or 390. So UV, some eyeglasses, you can get even lower ones, lower cutoff. That's important. If you don't have eyeglasses, then you can at least wear a hat, protect from the sun rays. That's very important. Obesity, another risk factor. Steroid medication use, that also can cause cataract. So if a person is on steroid medication for a year, most likely he or she will get cataract. High blood pressure, previous eye surgery is also a risk factor. Because people, if they have undergo some retina-related surgery or vitreous surgery, at that point, what happens is during the surgery, that leads to increased oxygen level in the vitreous. That is an oxidative stress that leads to increased cataract incidences. There comes the family history. In your family, if a youngster has a cataract early age, that could be a genetic reason. That's why it's important. If a child has a cataract, then it's very important, should be operated as early as possible. Otherwise, it will have an effect on development of the whole eye and also the retina. That's important. So generally what they do is, if the child has a cataract, just remove the cataract lens and put an artificial lens. Then the child can see well normally. Any other eye injury or inflammation due to bacterial infection or some other things can also be a risk factor for cataract formation. When the eye lens has so many risk factors, it also has a lot of defenses within the lens. So this tells about all the metabolic activity or biological activity going on within the lens to how the lens tries to keep it very healthy. So I'm not going to go to the details about it, but so you can appreciate how complex it is, even the lens by itself. So many regulations happening so that the lens is kept transparent for 50, 60, 70 year time. But ultimately things fail and one can get cataract. So the next slide summarizes the major events occurring during the cataract formation. Usually I mentioned the lens proteins. They are fairly uniform in size, or there are a couple of different sizes, but they are not clumped together. But what happens is, with the aging, they can get modified, then they clump together, become light scattering particles. That is called cataract. So other possibilities, same lens proteins, they break down, become small molecules. These small molecules, they start clumping together. Then they can form light scattering aggregates. This is resulting in cataract formation. So currently, with respect to India, they perform about 90 lakh cataract surgeries. In the US, about 30 lakhs. So Indian population is much larger. So one can expect. Still, there is significant backlog. About 50 lakh cataract surgeries are needed immediately to take care of the backlog accumulated during the COVID time. Patients didn't go to the doctor. Doctor offices were not open. So it's a significant backlog is there. So there's another 50 plus lakh people, they need immediate cataract surgery. But there's lack of ophthalmologists in India, because in India, there are only about 15,000 to 20,000 ophthalmologists, not quite enough to take care of all the needs of the patients or the population. In the US, there are about 8,000 ophthalmologists. See, the Indian population is 4 times larger. So that way, India needs at least 50,000, 60,000 ophthalmologists. This big demand is there. Healthcare is, it's not available for everyone in India. That is another problem. So for what can be done for that? People, we have to take care of it. Try to delay the cataract formation. That means what one can do is wear sunglasses, so protect the eye from the UV rays. If person is smoker, quit smoking. If diabetics, control the blood sugar. That can also delay the cataract formation. It's estimated that, if you delay the cataract formation by 10 years, we can reduce the requirement of cataract surgery by half. Because it's a general estimate made that nearly half the people who have undergone cataract surgery, they live only about 10 years after their cataract surgery. That's one estimate. Of course, other half, they can live for another 20 years, 30 years. So that's why it's important to take care of our eyes and lenses. Again, here, with respect to food, again, green leaf vegetables, carrots, sweet potato, blueberries. That means you have to take some antioxidant containing food that is good for the lens health. If nothing helps, then go to the doctor, ophthalmologist, who can remove the cataract and put an artificial lens. These 2 pictures, they are the artificial lenses. They just go into the place where the bad lens was there or the cataract lens was there. Of course, researchers are looking to develop some drugs to delay or prevent cataract formation, but they have shown some promise in animal studies, but it will require some more time to carry out human clinical trials to determine whether they are useful for humans and can be given as either eye drops or with the food. So that's something about lens. Next I will briefly talk about glaucoma. Glaucoma is another leading cause of irreversible blindness. In the US, there are about 3 million people with glaucoma at this time. And in the world, it is estimated that about 76 million people have glaucoma. By 2030, it is estimated the number of people having glaucoma will be about 95 million. The problem is the glaucoma is a silent blinder. In the sense, generally, you won't know that you have glaucoma until you start losing vision. That's why it's important people look into the risk factors, especially if you have a family history or somebody in your family has a glaucoma or a sibling having a glaucoma, then you have a higher risk of getting glaucoma. Eye pressure can lead to glaucoma, increase in eye pressure, but it's only a small percentage of glaucoma due to eye pressure. That's why it's important to check the eye pressure, at least, once a year after you reach the age of 40 or 50. So about 90% of people have the eye pressure ranging from 10 to 21 millimeter of mercury. So normally average is 50. That's somewhat normal. So if some people, even with the 20, 22 eye pressure, they will have a normal vision. They don't have glaucoma, but some people will have glaucoma. Glaucoma means, the retinal ganglion cells, the cells in the retina, they start dying. That's the problem. Then you cannot replace them. So coming to the symptoms, these are some of the symptoms that might suggest that you may need to go to a doctor, ophthalmologist, to check your eyes, check the pressure and check the retina and see whether there's an issue there. If you start seeing halos around the lights, if you have vision loss, eye is redness, haziness in the cornea, if you have some pain in the eye due to increased pressure, if you have some blind spot, central vision or tunnel vision, some headache. These are some of the symptoms of glaucoma. So better to get it checked out. That's very important. So what are the risk factors? High increased internal eye pressure is a risk factor for glaucoma. But just the age by itself is a risk factor. If you are a Black, Asian, or Hispanic heritage, then you have increased risk. Family history, I already mentioned about it. Some of the medical conditions, for example, diabetes, headache, high blood pressure, or sickle cell anemia. Or the individuals with the thin cornea, they have high risk of getting glaucoma. Long-term use of steroid medication, that's also a risk factor. And other one is the myopia or farsightedness. So that's another risk factor for glaucoma. So what do we do if a person has a glaucoma? Try some medication if the glaucoma is due to increased intraocular pressure, or do a surgery, filtration surgery. And there are some medications there developing now to treat the glaucoma. So, but it's better to take care before getting it. So I will cover a little bit about retina. So the retina, this figure illustrates the cross-section of the eye. And far right, you see the detailed picture of the retinal layers. So you have the retinal ganglion cells and photoreceptor cells. So that's how the light that's coming through the cornea passes through the lens and falls on the retina. That's where it is processed. The light energy is converted into electrical energy. Then it goes to the brain through the optic nerve. So this, you can see it's how complex, how intricate it is. So any problem with any one of these cell layers can be a big, huge problem. That's why it's important to take care of the retina as well. So in the US, about 2 million people above 50 years old have AMD. AMD is age-related macular degeneration, because in the retina, a spot called macula is there. That is the highest sensitive part of the eye. the light from there is more recognized by the is more high sensitive part of the eye, and then it directly sends the signal to the brain. So any problem with this macula fovea region, that will lead to macular degeneration. So the cells and the nerve cells, they die there. That's the problem. So we have to be careful about it. So common symptoms is the reduced night vision. At the advanced stage, the vision becomes blurred and the straight lines appear wavy. So that's the early indications of AMD. Patients with AMD have 1.2-fold higher risk of developing Alzheimer's disease than the patients without AMD. So there is a saying that, eye is the window to the brain. So Alzheimer's disease affects the brain. So whatever happens in the eye can directly affect the brain also, or it is an indicative of what's happening in the brain. So it's important that, if you have AMD, try to treat it. It can be early indicator of future Alzheimer's disease occurrence. So what happens during the AMD formation? So basically the retina, this is the retina picture. You can see this all the white spots. That's the macular degeneration happening here. See, this accumulation of some drusen in the both retina pictures you can see. So what are the risk factors? The one is the age itself, family history and genetics. That's another component. The race, macular degeneration is more common in Caucasians. Smoking is a risk factor, obesity, cardiovascular disease, and diet, or the food with the high animal fats or vegetable oil. All these are risk factors. So these are modifiable things. We can't modify the age, but we can possibly modify, quit smoking, reduce weight, take care of heart disease, and control the diet. So these are some of the ways we can prevent AMD from forming. So those are important things. Then again, the AMD, there are two types, dry and wet. So dry is the most common type. It's about close to maybe 90%. And the wet is only about 10%. Dry AMD, the photosensitive cells, they slowly start dying, they break down. So they again, progress through early stage, intermediate stage, and advanced stage. In advanced stage, we call it as a geographical atrophy. Atrophy means, it's dead. You cannot revive it. You cannot replace it. That's why it's very important. It's very debilitating disease, dry age-related macular degeneration. At this time, we don't have a treatment for it. Wet age-related macular degeneration, there is some leaky blood vessels, they grow. They ooze out some fluid that detaches the retina from its position, and then it leads to wet age-related macular degeneration. If it is not treated, that can lead to blindness. For this, there's some medication now, it's called anti-VEGF. They have to give injection to the eye, either 6 injections over a period of 6 months or 12 months. That can help and provide some relief. That's very important. One takes care of it at early stage. Other than that, what we can do, there is a study done by the National Institute of Health. It's called ARED-2 study for AMD. So what they suggest is, you have to take some vitamins C and E, lutein, zeaxanthin, and then some zinc and copper oxide, small quantities. So all these things, they help delay the AMD formation. So the simplest thing what we can do is use some good food, in the sense, take some vegetables, green vegetables, and then some carotens, carrot, sweet potato, etc., broccoli, kale, etc. So these are good for your retina and also for the macula, the more sensitive part of the retina. You need a good food, good vegetables sources, fruits, green vegetables. Those are really good. For example, green pepper, orange peppers, broccoli, and you can spinach. These are good. Walnuts. These are all milk. Those are all good nutrition for macula. So then comes the diabetic retinopathy. This is another debilitating disease, so to say, if untreated. So there are two kinds of diabetic retinopathy. So basically, the diabetic retinopathy is, with the diabetes, the blood vessels start becoming leaky. So they ooze out blood. So the eye will be, blood red eye person will have. A person will have a bloody eye, in the sense, blood oozing within the eye. So that causes a problem, that causes a vision. So there are two kinds of there. One is non-proliferative, another one is proliferative. So as the name implies, non-proliferative is less severe disease. Proliferative is more aggressive form of diabetic retinopathy. Again, this can be controlled by controlling first diabetes and also give some treatment. One can change the lifestyle, dietary changes, exercise, etc., will help to slow down the diabetic retinopathy. So what we do to keep our eye healthy? Keep eye healthy and protect our vision. What we can do is get a comprehensive eye exam done. That's important. That way we have a basal value. How is our retina? How is our lens? How is the intraocular pressure and all? Then just check how much risk you have. Whether one has obesity or overweight, has diabetes, risk for diabetic retinopathy or cataract, has one has blood pressure. Is there any family history like macular degeneration or glaucoma? And the heritage. All these things one has to, this is called self-evaluation. Then go to see a doctor. That's important. Then once you know your status, how you can help maintain a good eye health is eat healthy food, leafy vegetables, for example, spinach, kale, or amaranth. Those who eat non-vegetarians, they have some options. Stay active. So control the diabetes, blood pressure, cholesterol, etc. Quit smoking, which is a risk factor for AMD and cataract. Protect your eyes. Wear sunglasses, protective eyewear. So even the sunglasses, it's better to have the sunglasses which is a wraparound, because even from the sides, the sun rays can go to the eye and affect the lens. That's why it should be a wraparound, we call it as. So give rest to eyes. If you are using computer, every 20 minutes, take a break. That's important. Because the study has been done that there's a high correlation between handheld device use and the myopia or nearsightedness. The kids these days they have high incidence of nearsightedness, or they need eyeglasses because constantly they are looking at the handheld devices such as cell phone or computer screen, those type of things. Better to take a break every 20 minutes. So other thing what are the good source of some of the vitamins and zinc that's recommended in ARED study or a nutritional recommendation for eye health? So vitamin C containing food, for example, oranges, grapefruit, strawberries, tomatoes, red and green peppers, etc. Vitamin E containing foods include almonds, sunflower seed oil, avocados. Zinc is present in legumes or lentils. And lutein and zeaxanthin, again in green vegetables, spinach, Swiss chard, broccoli, or the fruits like raspberries, papaya, peaches, mangoes, etc. So all in all, the take-home message is know your risk factors, have an eye exam, eat healthy. So healthy food is good for not only eye health, it's also good for your overall body health, heart or brain and other things as well. And these are some of the resources I used. So I will end there. Thank you again for inviting me to make a presentation this morning. I hope it will be helpful to you, or at least you can use some of the suggestions in your own life. Thank you.
So thank you, Dr. Krishna Sharma garu. See, today we had a Netra Jignasa, Sanskrit life, if you want to put it. Today we had just investigation into the knowledge of the eye, the Charma Chakshus, and really we are benefited too much. And actually, eyes are very important, and you have given the important information and what eye is there and all that. It's really worth the information for any gender, for any person who have eyes. And therefore, the presentation is simply very much instructive, informative, educative, and we had to follow your guidelines that we have shown, that how important is our health, and the food is important, and the food also determines the condition of the eye, the health of the eye, and also the caring of the eye. All these things too happen. And today we are able to note the important parts of our eye inside. Only we say chakshushpa agne chakshurme dehi. And so we say chakshushpa and chakshu. So the pa is the protector. The protector of the eye is Agni, is Sun Bhagavan and all that. But that prayer, when we do it, it will have impact or influence on us, and our eyes will be quite nice. So Charma, Chakshu, and then, of course, Gnana Chakshu, we have got the knowledge, Vijnanam. And so we are now able to, your Nada Veda Adhyayana Kendra, which speaks about the sound research or Nada, and also Nada Vimarsha and also Veda Vimarsha, trying to understand. Now you have been able to give us what is on the medical side, on the clinical side, and what are the problems. So with your wonderful talk, we will be able to benefit and follow all that. Now Dr. Gopi Chand is there. He is an internist in medical, he's MD, and he has rich experience. At present, he is there in the Victoria Hospital, Bengaluru, as a consultant also. And he was in army, and so he will be, and he's a good student of our Veda Adhyayana Kendra, learned so much. And one more compliment for him is that in a medical conference, he just introduced Veda prayer before any meetings or anything. So everybody was wondering how you learned Veda Ucharana and all that. So such a dedicated student and all, Dr. Gopichan, he will be making some comments on that or remarks. There is nothing to add, but something about it he will be talking to us. Dr. Gopichan.
Sir, good evening, sir. Can you hear me, sir?
Yeah.
Yeah. So, good evening, the Professor Krishna Sharma and Prasad Kalyam and Vasan and other participants. And really, it was a good talk, sir. So, you covered almost all the diseases of the eyes, starting from the cornea, lens, and retina, and everything. So it was a very informative, and it was more an eye opener for non-medical people, especially. So what I would like to add, one thing is, though the eyes is only through eyes only we will recognize the things. Eyes will only act as a tool, but what we see actually is from the mind, from the brain. So it is the brain which will ultimately accumulate into the images and then make the conclusion. Because I was seeing in sometimes about a year, 1 or 2 years back in this one Discovery Channel, there was one mountaineer who loses the eyesight, and after that, the same thing it has happened in US or something like that. So they will devise some mechanism, some instrument, and they will put it into his mouth. So he could recognize the things through the sensation from the tongue. Ultimately, he becomes a successful climber. So what I would like to stress is, whatever it is, that we will see everything from the mind or the brain. So eye is just acts as a tool, and in any case, eye is important. Through that only we can see. And even the blind people also are surviving, though they are not able to see anything. Though the entire world is dark for them, still they see the things and they perceive the world. So with that this thing, anyway, it was a very nice presentation, and I was told that you are a faculty in the University of Missouri. So it's a congratulations, sir. You have done a nice job, and I would like to thank you, and I would like to thank my guru, Professor Prabhakar Garu, who has given this opportunity for me to give this concluding remarks. And thanks to Prasad Kalyam, who conducts this program in a very excellent way. Thank you so much, sir. Thank you so much, sir. Namaskaram. Thank you.
Thank you, Gopichan sir. Thank you very much. So I thoroughly enjoyed Professor Krishna Sharma Garu, how you started connecting our eyes, like how we do the Achamanyam, left eye is Aniruddha, right eye is Purushottama. And also in our culture of deities and having visual aspects of God, how our eye becomes really the way to connect to spirituality. I think those are all very interesting points. Also, you talked about the Ayurvedic representation of how we visualize things. That was very exciting. I had no idea there was the Ayurvedic interpretation of all the mechanistic activations you talked about, all the biomolecules. I wish we can talk more about it some point, but it was very exciting to see that. I had no idea that was knowledge in our Ayurveda. And yes, as Dr. Gopichan said, it's very educational for somebody who's not an expert in medicine or diseases. As an engineer, I do go to a doctor and get checkups, and all these are topics which comes in discussion, risks and all of this. And I was able to get a very clear picture. I am less clouded now in terms of understanding what is going on with the eye, and how I always wondered dietary habits, blood pressure, how that impacts the eye. I always wondered. I think you've given a very clear explanation for all of those things. And last but not least, very good quotes. Eye is window to the brain, and eye is the most important of all the organs. And as Dr. Gopichan said, it is critical, but as humans, we have tried to live with trauma to it or without it. Still life goes on, but still it is the most important organ that we all should definitely take care. Like you said, you give a lot of advice on how to take care of the eye, and diet and being active, and especially computer usage. Also, you touched upon that, how it is important to rest in between. So it's a wonderful talk, very informative, lot of great points, and we really appreciate your wisdom. Thank you so much.
Thank you, Bakar, as well as Prasad. And Dr. Gopichan made a good point. All the processing, that's the CPU. The brain is the CPU. Just like in a computer, it processes everything. Certainly, he referred to a device that was attached to brain, through the tongue. So certainly, the Stanford University, they are working on it. So other things. So retina, though it's, even they have developed some implants, and that can process the visual signals and send the electrical signals to the brain, where the brain can process. That's what the Dr. Gopichan is mentioning. So certainly, that's the way forward for people who totally lose their eyesight, or either due to accidents or genetic factors or other things. There is a way. So there is, in the US, the NIH is spending a lot of money on these areas to develop artificial retina, so that signal can be generated from the external source. Then it can be sent to the brain. So the issue is connecting to the correct location within the brain, to the exterior, whatever process is done. Similar thing is happening what people cannot hear. If there is a issue with the external eye, so external ear, then they can be sent signal to the brain directly. That hearing devices, same thing. Similarly, certainly advancements are happening, but some of those are very expensive. It's not available to everybody. For example, just last week, FDA approved one medication treatment for this kind of disease, so blood clotting disorder. The cost is $3.5 million for one treatment. I mean, put it in terms, it's 25 crores just for one person's treatment. How many people can afford? So that's another thing. But certainly advancements do happen. Certainly, sooner or later.
That's for hemophilia, hemophilia, if I remember. That was for hemophilia.
Hemophilia.
Yeah. 25
So
crores or something.
Yeah, that's how many people can afford it. Then, some cancer drugs, they cost $500,000, $500,000.
Okay.
Yeah, that's all. I'll stop there. Yeah.
So now we have got that. See, actually, even the nerves are also important. Optical nerve, that is the important thing that gives you all that, and signals are all. Now we have got the neurologist also, Harati Bhandari, very famous, and she has already given us a good knowledge about the brain and about the nerves and all that earlier. Before our Krishna Sharma spoke, she is the predecessor for this type of. So now I have just we have got a neurologist, and she will also be adding some points, I believe. So Harati Bhandari, experienced doctor, same in Missouri University. Welcome, madam. Please. Yeah, you're muted.
You're muted. You're muted. Yeah.
Good morning, everybody, and it's such a wonderful opportunity to at least to speak few words about you, sir. And it's such a great lecture. Thank you for taking time to give such a wonderful lecture here. And I know, healthcare industry is going this way, and thank you so much for giving such a wonderful lecture.
So what about the nervous part role in this eye health and eye vision and all that? Bhandari.
So, sorry, I couldn't hear the lecture. I'm on call. So you're asking me about which nerve is involved in the vision. Optic nerve is the one which is involved in the vision. So nerve supply is the key. So if there is any injury of the nerve, if for any reason, vision is automatically disturbed. And especially being a stroke specialist, depending upon the area which is affected during the stroke, so the particular vision part is affected. It's called as visual fields. For example, let's say if occipital lobe of the brain is involved, then obviously certain parts of the visual fields are affected in the patient. So please let me know if you have particular questions.
So the optical nerve is very much connected and very much important for all health in the eye. Do you mean that? So what is the nutrition for that, to keep that eye, that nerve, optical nerve safe and promotive and helping, not going to any problems?
So in general, eye health, usually, he already explained you everything. With respect to brain, as long as you protect your brain, controlling the hypertension, then you're giving the highest chance to protect your brain from stroke. So as long as you don't have any stroke in that area of vision, occipital lobes, then you're protecting from your side, especially not getting the stroke and especially not affecting the vision.
Yeah, I don't know much about it, and so anyway, we have got doctors to put any more questions to her and get some useful information for anything. But anyway, eye is very important, and in our the entire Sahitya, in our Vedas, there is a lot of information regarding the eye. We have got Aruna Prasna, where Surya Bhagavan, the protector and monitor and all that, is a light radianced. And we have so much about the eye information. And so apart from the Vedic, but this is now the clinical and practical and useful and repairable knowledge that has been given to us by all the doctors. And everywhere there is a dearth of really supporting persons, doctors, as he was, Krishna Sharma Garu was telling, that there is also dearth in the number of doctors connected to the eye health and eye operations and surgeries and all. But anyway, we only wish that because of the grace of Surya Bhagavan that we have organized on this Sunday, we all want to have our eye health well protected till the last breath of life. Thank you. Now that Bhandari has taken some time out to talk about the nervous role in eye health and eye care. So she says that, is it only optical nerve connected or any other nerves too connected to that?
So optic nerve is for vision, and there are other nerves, 3, 4, 6. There are many cranial nerves, especially 3, 4, 6 are responsible for eye movements. So when there is any stroke in particular part of the brain, these muscles of the eye are affected. And in that case scenario, the eyeball will be moved to one side. So then the patient will have double vision. So there are many things connected to it. So optic nerve is the second nerve, and 3rd, 4th, 6 are the muscles of the eyes, extraocular muscles. So again, depending upon the type of the stroke, which muzzle of the eye is involved and the patient's present with double vision. And then we will know, okay, this is the place where he had the stroke. That's why he's presenting with these symptoms.
So thank you, Prasad. You give her your own remarks and then a vote of thanks, because these are the three very busy doctors. But they have
Yeah, thank you. Thank you. Thank you so much, Harti Garu. I know you were able to join at the last moment, give some thoughts. Thank you so much. I just summarized the wonderful talk that Krishna Garu gave. He connected, spirituality with eye care, because we are idol worshippers in Hinduism. We connect spirituality with the form of God. He talked about a lot of Ayurveda views of eye mechanistic activations, and he talked about diets and preventive ways to deal with eye disease. So it was a very wonderful talk. I'm glad at least you joined at the end. Thank you for your thoughts. And I want to end with the Shanti Mantram, which is Bhadram Pashye Maksha Bhirya Jatraha. Yes, I thank
Suman, Vasan, and
Vasan for the chanting, Suman Nagendra for the songs, beautiful songs on Kande, with eye references. Gopijan sir, thank you so much. And Krishna Sharma sir, very, very wonderful. I really enjoyed. Thank you very much. And so this last Bhadram Pashye Maksha Bhirya Jatra, so we'll just chant that and end the talk. Om Bhadram Karne Vishrunuyama Devaha Bhadram Pashye Maksha Bhirya Jatra Tirairangai Stuštuvagum Sastanobhihi Yasema Devahitam Yadayuhu
Swasti na
Indro Rudrashravaha
Swasti na Pusha Vishwavedaha Swasti nastarksho Arishtanemihi Swasti no Buraspatir Dadatu Om Shanti 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 Hari Om Krishnarpanamastu Shri Veda Purushar Shirvadostu Om Tat Satam